Hello and welcome to the 2023 Sexual Assault Awareness Month webinar series. Our presenter today is Dr. Julie L. Valentine, Associate Dean and Associate Professor at the Brigham Young University College of Nursing, and also a Certified Sexual Assault Nurse Examiner with Wasatch Forensic Nurses. Without further delay, here is Dr. Valentine.
Welcome to the webinar, Low Prosecution Rates in Sexual Assault Cases. Can we make sustainable improvements? I am Dr. Julie Valentine. I would like to acknowledge first my research collaborator, Dr. Leslie Miles at Brigham Young University, and also acknowledge and express appreciation to research partners, Utah County Attorney David Levitt and his office, Utah County Police Agencies, Salt Lake County Police Agencies, Wasatch Forensic Nurses, the Sexual Assault Nurse Examiner team in both Utah and Salt Lake counties, and Utah Bureau of Forensic Services, the Utah State Crime Laboratory. I also would like to especially acknowledge the many survivors whose voices are represented in this research. I also clearly want to state that the opinions represented in this webinar are mine and not reflective of FTCOE or National Institute of Justice. So let's dive in. The learning objectives are four. One, I hope participants will verbalize understanding of the challenges faced in tracking sexual assault case processing, and then to demonstrate an understanding of a tool that we will be discussing, the National Institute of Justice Sexual Assault Nurse Examiner Practitioner Evaluation Toolkit, a mouthful and highly important, and to analyze factors affecting prosecution rates in adult sexual assault cases, and finally to discuss and really ponder how to improve sexual assault case processing within participants' own jurisdictions. So let's talk about our current climate. A lot has happened, especially, I think we could say, the last 3 decades when we look at rape reform laws, and especially in the last decade when there have been a lot of attention on Title IX, on college campuses, the high rates of sexual assault. There has been a increased focus on teaching about affirmative consent. There have been warehouses where large amounts of untested rape kits have been found, which launched the Saki and Danny initiatives to test these backlog kits. And then we also have the Me Too movement. So we can look at all of those things combined and think, wow, there's been a lot more attention to sexual assault in our society and the laws around sexual assault. So are we making a difference? Are we decreasing sexual violence? And are we improving prosecution rates of sexual assault cases? That's what the focus is of this presentation, this webinar. So we first have to consider, how do we measure prosecution rates? And I'm focusing today on adult sexual assault cases because the research that I'm going to be presenting to you is all on cases where the victims were 18 years or older. How do we measure this? We first have to think about what's the denominator. We know that sexual assault is highly underreported. So do we take all the sexual assault cases? Is that the denominator? Do we think of all sexual assault cases that are reported to law enforcement? Or is the denominator sexual assault cases that are reported to law enforcement that have evidence collected, or sexual assault cases where charges are filed? What is the denominator? That is a critically important question because when we look at trying to compare prosecution rates, we have to look at what are we really measuring. And then we have to consider, how do we determine the denominator. That ties into the next question. How are sexual assault cases reported? Those that are reported to law enforcement, how are they tracked? Now, I'm a nurse, and I'm going to compare this to healthcare. When a patient reports to a healthcare clinic, let's say they report for a headache, there is an immediate code generated that they are there for a headache. If during the examination something else crops up, they also have a rash, then another code is added. Now, these codes are very important because that's how people get paid, based on the code that they are assigned. So in healthcare, we have big data where we can run numbers on how many patients are seen at this clinic that report headaches, or how many patients are we seeing at this clinic for back pain, because we have those codes that are assigned to those patients. But our tracking in the criminal justice system is not at all at that level. I know where I live in Utah, if someone reports a sexual assault case to a law enforcement agency, that is not immediately assigned any number, any way to track that information, to track what happens to that case. So then we need to discuss a tool that allows us to track this information and what the denominator is used in this tool. The tool that I'm going to be discussing and sharing research about is the National Institute of Justice Sexual Assault Nurse Examiner Practitioner Evaluation Toolkit. One of the greatest research projects that I believe NIJ has done. I'm a huge fan of this toolkit. Dr. Rebecca Campbell out of Michigan State was the lead researcher in developing this toolkit and implementing this toolkit. So this was a grant that she received. It was developed to measure criminal case outcomes in sexual assault cases within communities with established sexual assault nurse examiner programs. So we immediately know the denominator. The denominator in this case are sexual assault cases in which the victim reported to a SANE team and received a sexual assault medical forensic examination. The reason that this toolkit is so important, or one of the reasons, is because it allows us to compare communities to communities, and it also allows us to compare for improvements or changes in a community. I implemented this toolkit in Salt Lake County in 2013 for the first time, and because cases in the criminal justice system take some time, it's recommended in the toolkit to look back, to give 2 years and then look retrospectively. So I looked at sexual assault cases in Salt Lake County from 2003 to 2011. I want to dive a little bit more into the importance of measuring outcomes. So this toolkit is a pre-designed statistical package. I will tell you that the instructions are so clear. You do not necessarily need a researcher to implement this toolkit. Any community, any SANE program can implement this toolkit with collaboration from their clinical partners. When we look at what are the outcomes of sexual assault nurse examiners, we need to be really clear that the most important outcome is providing trauma-informed, victim-centered or patient-centered care to victims who report sexual assault. And that is the most important. But we also need to look at what are the other impacts that a SANE program might have in their community. And some initial research before the toolkit was developed indicated that in communities where there were SANE programs, there were higher rates of prosecution in sexual assault cases for a number of reasons. One, high quality evidence was collected following the sexual assault in sexual assault kits. The other is that victims felt more supported when they were with a SANE who was trauma informed and helped support them initially. And then they've also found that in communities where there's SANE programs, there's generally greater levels of multidisciplinary collaboration. This toolkit provides very necessary baseline data on specifically the prosecution or criminal case outcomes. And again, it allows communities to compare findings because we have an apples to apples approach. Now, that picture that I have at the bottom there is a scale. When we look at, if somebody were to go on a diet or a weight training program, they would first find out, all right, what's my starting point? What's my weight at this time? And then they would do some interventions and then measure later, have I made any improvements? That's what this toolkit also allows individual communities to do. So it really should be used where you measure once, a community makes improvements, you go back and say, has this made any difference in our criminal case outcomes? So the denominator again, sexual assault victims who received a sexual assault medical forensic examination by a SANE in a community with a SANE program. The information, the research I'm going to be sharing with you are all victims who were 18 years or older and wanted to report to law enforcement. So we do not have any information on what is commonly referred to as restricted cases. So here are the research steps. Initially, you look at a population of eligible cases. Again, the eligible cases over 18 years of age. Fully collected sexual assault kits. The victims wanted to talk to police to pursue case prosecution. So go back to your high school or college stats classes and remember that if you take a population and you randomly select a sample from that population, you can generalize your conclusions from that sample back to the population. So the key is randomly selecting those cases. So the toolkit uses a random selection of cases and very clearly describes step-by-step how to determine that. Next is to look at the cases screened by law enforcement with prosecutors, then the cases with charges filed, and then the prosecuted cases. And you'll see there's 3 outcomes for prosecuted cases: a trial with acquittal, trial with conviction, or a plea bargain. And then we go down to successfully prosecuted cases, which is defined by the toolkit as a trial with conviction or a plea bargain. And as many of you likely know, the majority of sexual assault cases that we would say are successfully prosecuted are plea bargains. When we look at the outcome measurements from the toolkit, the first is sexual assault cases screened with prosecutor's office. How many of the cases where the victim had fully collected sexual assault kits did the law enforcement agency screen with the prosecutor's office? And then it assigns criminal case outcomes to not charged, charged but later dropped, pled or plea bargain, trial with acquittal, and trial with conviction. So here are the results from my initial study from 2013. We found that 34% of cases where the victim had a fully collected sexual assault kit and said, I want to talk to law enforcement to prosecute my case, 34% were screened with the district attorney's office. So that means that 2/3 of these cases stopped at law enforcement. The prosecutor's office never heard about these sexual assault cases. So that was our baseline data points. also as additional baseline data points from Salt Lake County, which is the largest county in Utah, and it is an urban county, so we can compare Salt Lake County to other urban sites that have implemented the toolkit. And you will see here that Salt Lake County had higher amounts of cases that were not charged, higher amounts of cases that were not prosecuted, and higher amounts of cases that were not successfully prosecuted. In fact, out of all those cases from 2003 to 2011, where the victim had a fully collected sexual assault kit and said, I want to talk to law enforcement to prosecute, we had a prosecution rate of 6% and a successfully prosecuted rate of 6%, meaning there was actually only one case where there was a trial with a acquittal. Most of these were not prosecuted at all. So these findings were published, and we have those references listed at the end. But a news agency in Utah, the NBC station, launched their own investigation after our research was shared in the media, and they did different steps than were outlined in the toolkit. And they found almost identical results. They examined 2,318 sexual assault cases, and they found that 2/3 of the sexual assault cases were never referred to the DA's office. And they found that 5.5% of sexual assault cases were successfully prosecuted. This was roughly identical to the toolkit findings. This really helps to verify the findings that we obtained in implementation of the toolkit for Salt Lake County. So now let's jump to when our research team, Dr. Miles and I, re-implemented the toolkit in Salt Lake County and looking at cases from 2012 to 2017, again, looking to see, we've done a lot of work in our state on law enforcement education, have we made any differences? And then also to get baseline data from Utah County. Now, Utah County is the second most populous county in the state of Utah, but really is a mix of urban, suburban, and rural communities as well. It is smaller than Salt Lake County, did not have as many eligible cases, and you can see the numbers here of the randomly selected cases. Now, the NIJ Toolkit guidelines are to select 30 cases per year. We went over that. We did 41 cases approximately per year for Utah County and about 46 cases per year for Salt Lake County. You look at a power analysis to say, are we selecting enough cases? And you want it over 0.80. Those case numbers exceed the power analysis of 0.80. We received some pushback in our earlier implementation of the toolkit about not looking at all of the cases, doing this random sampling of cases. So we also took 1 year so that we could see, is this random sampling of cases representative of all of the cases? So we took all of the cases in Utah County from 2017, and we looked at the full sample findings and compared it to the random sample findings, and we found them to be equal. So we are very confident that this random selection of cases indicates what is happening with the overall population. So we had different steps per county, and the toolkit will walk you through different steps that work for your jurisdiction. In Utah County, we obtained the criminal case outcomes through a collaboration with the Utah County Attorney's Office. After we shared our initial findings, the Utah County law enforcement agencies wanted to be part of the study and provide some additional information, and so they were added into the study. In Salt Lake County, the district attorney's office declined to participate as a research collaborator. And so we established memorandums of understanding with the police agencies We had all of the police agencies except two that opted not to participate, and they were two, one campus and one small community agency that were not involved in this round of the toolkit implementation. We don't think that that made any difference in our outcomes. These were small agencies. Then we randomly selected these cases, divided into police agencies. We had a contact at every police agency. We provided the information of the randomly selected cases. The law enforcement detectives looked up the cases, and they provided information on suspect names only if they were screened with the prosecutor's office. They also provided information on if they were not screened with the prosecutor's office, why they were not screened. And then we retrieved these lists from the police agencies, and then our research team used public records to look up the criminal case outcomes. Sounds long, but we are spelling this out in our article, and I promise you it is worth it and actually helps you to build relationships within your communities. So here's the findings. If we take Utah County, and here's 100% of the randomly selected cases, we had 59% of the cases stopped at law enforcement, meaning that the prosecutor's office never heard about these cases. Again, all cases with fully collected sexual assault kits in which the victim said, I want to talk to law enforcement to prosecute my case. We found that 27% of the cases were formally screened with the prosecutor's office. When the law enforcement agencies wanted to be involved, they wanted to provide information about how many percent of cases were informally screened. So let me talk about how we defined informally and formally. Formally screened means that there was paperwork filed in saying this is this sexual assault case, here's our investigation so far, and having a more formalized meeting with the prosecutor's office to discuss the case. Informally screened generally was a casual in-person discussion, or many times on the phone, hey, I have this case, what do you think of it? Nothing formally screened. When we added in these informally screened cases, we found that it did not change our criminal case outcomes, meaning that the informally screened cases ended up not going anywhere, or then became part of the formally screened cases. So out of those cases that were screened with the prosecutor's office, 14% had charges filed. We found 1% of cases were not adjudicated. Now, Utah has a SACI grant and a DANI grant. And so there are some cases that are being re-looked at, and some of those cases cropped up in our randomly selected cases. And so they were not yet adjudicated. They had been reopened. So 14% of the cases with charges filed. We then found that 11% of the cases were prosecuted. 10% of those were successfully prosecuted. Again, successfully prosecuted means trial with conviction or a plea bargain. When we jump to Salt Lake County in our recent study, we found that 65% of the cases stopped at law enforcement and 35% of the cases were formally screened. Now, our earlier study, looking at cases from 2003 to 2011 that we did in 2013, 34% of cases were formally screened. In discussions with law enforcement from 2013, when we did the first study through now, many detectives told me, we're screening all of our cases with the district attorney's office. So when we still found this very low percentage, a little over a third of the cases, again, all with fully collected sexual assault kits where victims said they wanted to prosecute their cases and talk to law enforcement, we were baffled. We found that the range between law enforcement agencies went from 18% to 55%. So we had some law enforcement agencies that were screening very few, and some that were screening over half of their cases with the prosecutor's office. So in one jurisdiction, a substantial range in the law enforcement agencies. I want to go back to talking about that denominator, how important that is. When law enforcement told me that they were screening all of their cases now with the prosecutor's office, that all likely meant all cases that they felt like were good cases, that really were strong cases in moving forward. Definitely not all of the cases. So then we looked at charges filed. We found that 10% of the cases had charges filed. And we found even on higher rates, 2% of cases not adjudicated. Again, these were largely Saki and Danny cases. Then we found that 8% of cases were prosecuted and 7% of cases were successfully prosecuted, with the 2% of cases not yet adjudicated. So some improvements, and I will show those graphs comparing the earlier Salt Lake County study to now. Utah County, we did find a higher percentage of successfully prosecuted cases, but we also found a lower percentage of those not adjudicated that had been reopened. So when we compare our numbers between the earlier study and now utilizing the toolkit, you can see on this top line the percentage of sexual assault cases formally screened by law enforcement with prosecutors. We went from 34% in Salt Lake County to 35%. So not much difference there regarding cases that law enforcement was screening. But where we found a difference was actually what was happening in the prosecutor's office. The reason that we have higher rates of prosecution in Salt Lake County goes to the prosecutor's office because they are filing more charges in cases. Their declination rate dropped. And so hats off to the prosecutor's office for implementing changes and filing more charges in these cases. I want to show you some interesting charts. These are referred cases. So this is Utah County, and I want you to just pay attention to the trends of the lines. This is Utah County on the percentage of referred cases per year. This is the line when we look at prosecuted cases. When we overlay these two, the more cases that are referred, the more cases that are prosecuted. We found a similar thing in Salt Lake County. You can see in 2014, we had this huge jump in referred cases. This earlier study where we found this low prosecution rate, low referral of cases, hit the media big time on January 1st in 2014. We think that was a big reason why we suddenly saw this jump, but it was not sustained. Here's the overlay of the prosecuted cases. And then here you see, again, these match up. I've talked to law enforcement and said, the more you refer cases, the more cases will be prosecuted. Best practices are to include prosecution early on in sexual assault cases. So here's an overlay of these two together, again, reinforcing the importance of law enforcement working with their prosecutor's office, referring more cases. We will prosecute more cases. So here quickly are just aggregated findings. I know this is a lot of numbers here, but again, I really want the takeaway to be that most of these cases were not prosecuted. Still very low prosecution rates, although we did find improvement in Salt Lake County. So when we simplify these findings, you can see if you go down to the bottom lines, the successfully prosecuted in Salt Lake County and the unknown, We have this higher amount of unknown because of cases being reopened, which is wonderful. But we went from 6% to 7% in Salt Lake County. I really think a lot of these not adjudicated cases likely will be prosecuted. So then we might be at 9%. So going from 6% to 9% is substantial. So I'm going to share with you some additional information that's going to tie into the last points of our discussion. I hope that going over this toolkit, many of you have interest in implementing the toolkit within your communities. So we have a very large database where we have coded information from sexual assault medical forensic examinations and also from our state crime lab. This allowed us to look at variables that are associated with prosecution. All of the bolded and italicized variables were found to be statistically significant, meaning that they were associated with higher rates of prosecution. If a victim was grabbed or held, if they were strangled, if the victim was asleep and awakened to sexual assault. That's actually 14% of our cases. The victim reports that they were sound asleep and woke up to someone sexually assaulting them. Domestic violence rape, which includes ex-partners and current partners, so intimate partner violence, and that's about 14% of our overall sample. If there were more anogenital injuries, if a weapon was used, if a sexual assault kit was submitted, and in our collaboration with Utah County law enforcement, this was a variable that we only looked at in Utah County. We found that if the suspect was a minority, there were higher rates of prosecution. So we took all of these variables that were associated with prosecution and did a logistic regression analysis to determine what variables predicted prosecution. And this is what we found. For Utah County, we found that if the victim was asleep and awakened to the assault, they were 8.5 times more likely to have their cases prosecuted. If the victim was strangled, they were 5.45 times more likely. And if it was a minority suspect, they were almost 3 times more likely to prosecute those cases. In Salt Lake County, we found there was only one variable out of the many variables that we looked at that was actually a predictor of prosecution. And that was if the victim was asleep and awakened to assault. When we combined both Salt Lake and Utah counties, this variable of victim asleep and awakened to assault was such a strong variable, it actually canceled the other predictors out and was the only variable that predicted if prosecution happened. We tried to look at this as a jurisdiction, so we did not look at what about the individual law enforcement agencies. I shared with you that our range of referral of sexual assault cases and law enforcement agencies went from 18% to 55%. So certainly there is a lot of subjectivity and I would say bias on these cases, and you find huge differences within law enforcement agencies in one jurisdiction. But let's look a little bit deeper at this variable of victim asleep and awakened to assault. I think we have to ask the question, are sleeping victims seen as more righteous victims? They weren't engaged in any victim blaming behavior. They were simply asleep. We are all highly vulnerable when we are asleep. They weren't out partying in a bar. They weren't making out with the person. They were just asleep. So seen as a sleeping victim, we think they likely were seen as more righteous victims, did not have victim blaming attached to them. So as we worked with law enforcement agencies, we asked them if cases were not screened with the prosecutor's office, why? And so we gathered some additional information, and this was directly from what the law enforcement agencies provided to us. And this is what we found. Uncooperative victim. And that term can be defined in a whole bunch of different ways. I have found that there were some cases where a victim maybe met several times with law enforcement and then would not want to answer certain questions, being labeled uncooperative, or no longer showed up for meetings or interviews. So that's a catch-all phrase that really we need to dig in a lot deeper, but uncooperative victim was a top reason noted why they never referred the case for prosecution. But I want to go back to the fact that these were all victims that had a fully collected sexual assault kit with a sexual assault medical forensic examination. And at that time, they stated that they wanted to talk to law enforcement regarding prosecuting their case. So then we have victims did not want to pursue prosecution. So there was a switch, right? These were all cases where initially they said they wanted to pursue prosecution, but then we see this quarter in Salt Lake County and 21% in Utah County. Unable to locate victim was the next for Salt Lake County. The lack of evidence or unfounded, basically not believing the victim that this really happened or not having enough evidence. But remember, these were all cases where they did have a fully collected sexual assault kit. This was our highest variable in Utah County, 39%. That was the reason why cases were not screened with the prosecutor's office. You can see this false report, no crime recanted, 3% in Salt Lake County and triple that in Utah County. So let's go back to the strides we have made. Sexual assault kits within these counties, we have made huge strides, and this number is even now up to about 100%. We've passed a law, all sexual assault kits are to be submitted and analyzed. So look at that line, and this was from the data that we have collected on the percentage of sexual assault kits submitted. So huge strides, a lot of money, a lot of resources. But then here's our line of prosecuted cases. A growing dissonance between the sexual assault kits submitted and analyzed and the prosecution rates. Again, this shows the widening gap between these two. So every time you do research, you have to say, so what? Well, the big so what is we have made huge strides, and yet we still have that sexual assault cases are vastly under-prosecuted. We have to consider that. We found that the increased screening of cases by law enforcement results in increased sexual assault prosecution rates. The more cases that are screened, the more cases that are prosecuted. This huge increase in sexual assault kit testing, but the prosecution lags way behind. We believe that one of the big so what is more resources to police are necessary. Cuts to police funding will hurt victims and impede justice in these cases. And then we really want to dive into more this fact that victims are asleep and awake to being raped. Cases are more likely to be prosecuted. Is this because these victims appear blameless, righteous victims? And then we have to ask the question, now what? Our big now what is every jurisdiction needs to consider, does this matter to you? Do we want to improve prosecution of sexual assault cases? I would say a firm yes. To make healthier and safer communities, we have to agree that this is critically important. There is a great article, one of my favorite articles out of Arizona State University, Dr. Spahn, Sexual Assault Case Processing. The more things change, the more they stay the same. I highly recommend you all read this article. It talks about all the changes that we've made, But when we look at what is actually happening in these cases regarding prosecution and reporting, have we really made a difference? And how do we make a difference? So I think we have to look at what are societal barriers to prosecution of sexual assault cases. I would say the big one is not believing victims. We have research on this. We know that about 2 to 8% of sexual assault cases are likely false reports, but that's the same as other crimes. And this idea that there's a lot of false reporting in rapes only decreases reporting, and it only decreases the prosecution. And then structural barriers to prosecution of sexual assault cases. Everything from, does law enforcement have enough resources so that caseloads are not huge? Do we have enough victim advocates to keep victims supported and engaged? And then policies and legislations that can be changed. So I want to go back again to this chart. I think this chart would be very similar in every community. Every community needs to consider these reasons and say, how can we improve the case processing by looking at, if we have high rates of victims who do not want to pursue prosecution, what can we do to support them? How do we provide education to law enforcement? So the now what, when we get to the policies and legislation, that's another area every jurisdiction needs to examine. In Utah, we have a first-degree felony, which is rape, where it needs to be shown that the victim said or indicated no, not affirmative consent, but no. We don't have anything below that until it drops to a misdemeanor sexual battery. About 40% of the misdemeanor sexual battery are pleas from rape. We have tried for 3 years to pass a bill that would create a third-degree felony, sexual conduct without affirmative consent. It is patterned after legislation that they've had in Wisconsin for a number of years. I think every jurisdiction, every state needs to look at what are our laws that are impeding our prosecution of sexual assault cases, and how do we change our legislation to improve prosecution. So now what? Communities need to come together. We need to support community response, improve victim support services, implement criminal justice system ongoing training so that it is sustainable on trauma-informed approaches and policies, and examine state statutes defining felony rape charges to see, is it policy that also needs to change? Here are references and my contact information. Thank you.
Hi, everyone. I'm Michaela Askeles, a forensic scientist at RTI International. Thank you, Dr. Valentine, for your presentation, and welcome everyone to the last webinar in this series. Let's go ahead and get started with the Q&A. The first question we have from an audience member is, what happens with a hung jury in the toolkit measurements?
The toolkit does not have a specific coding or variable for hung jury. It has trial with conviction or trial with acquittal. So I think it would probably fall under the trial with acquittal, or it would, if further action would be taken, it would just be a case that was not adjudicated.
Okay, great. Thank you for answering that. Right. The next question reads, do you have a felony review team?
So the individual prosecutors' offices review felony convictions on the state level. In 2019, our legislature did pass a bill. It's Utah House Bill 281. Again, this is 2019, and it's called Prosecution Review Amendments. And what this bill did is it created a prosecutor position within the Utah Attorney General's office, and any victim can request that this prosecutor relook at their case. And most of the cases that go to this prosecutor are sexual assault or rape cases. They will relook at cases where a prosecutor's office evaluated the case and then declined to pursue prosecution, so it can have another look. And we do have several cases that have been, and especially victim advocates have helped victims refer cases there, and they have been reopened.
No, that's great. All right. Another question reads, was there a higher rate of prosecution when a victim advocate was involved in assisting the victim?
My guess regarding victim advocate is that it would be a strong yes, there would be higher rates of prosecution, but that was not a variable that I could track either in the data that I had from the sexual assault medical forensic exam records or from the information that I retrieved from the prosecutor's office or law enforcement. I know that all of our law enforcement agencies need additional funding, and part of the need for additional funding is to have more victim advocates. I think our findings really screamed out the importance that victims need more support. All of our patients that we see have a community-based advocate with them during the exam, but then the law enforcement-based advocates have huge caseloads. And I think if we had increased funding to increase the number of law enforcement-based victim advocates, that is a definite aspect that would improve prosecution.
And then similarly, there's another question that's asking, was there an increase in state or federal funding that would have been a variable with the higher prosecution rates?
Great question about the increased funding. Again, that was not a variable we looked at. We looked at related to assault factors and victim. We had a large increase in state funding for our state crime lab that had been struggling with funding for many years, and we went through all of the backlog cases. So there was increased funding there. I think all law enforcement agencies, a factor that we weren't able to measure, but I know in talking with the detectives that work on these cases, they also have huge caseloads. And if we want to really move the needle on improving prosecution, we have to look at increasing funding to law enforcement so that they get the additional personnel that they need to really investigate these cases.
Yeah, no, for sure. And we have another comment saying VAs are not paid enough to stay in the field, and why is that? And I think you might have already touched on some of those points.
Yeah, victim advocates, they should be making a lot more money, and the stress and there's a lot of compassion fatigue in that field. So we definitely need more victim advocates, but a really challenging role.
All right. Yeah, for sure. And then another person's just asking, what is that prosecution House bill number again?
Oh, so it is House Bill 281 in 2019 in Utah. It really has made a big difference, this prosecution review amendment bill and this creation of this new prosecutor at the Utah Attorney General's office.
All right. Thank you. All right, a little bit of a longer question, but how does testing of kits at the crime lab tie into screening with the prosecutor's office? In our state, all kits are tested at the lab and reports go out to law enforcement and the prosecutor's office simultaneously. Could it be the cases were not further screened due to lack of lab findings?
Great question. We looked at if cases were submitted, and obviously they were more likely to be prosecuted if they were submitted. In our state, when the kits are tested, a report goes to law enforcement. and not necessarily prosecutor's office. That's something that we have been in discussion about. And regarding the lack of lab findings, again, we did not have that variable to look at in this. We were looking at victim and assault variables.
All right. And then another question, the person asks, my one question is about combining lack of evidence and unfounded in the reasons given for not prosecuting. I would have loved to see those separated out since they are pretty different. So do you have anything you'd like to say on this issue?
So on the unfounded and lack of evidence, that is actually how law enforcement wrote it. So I would like more information on that as well. But that was, we took what they wrote down and coded their statements. So yeah, and we'd love to have more information on all of these, uncooperative victim. What does that mean? I will tell you, when I did the earlier study, I was with a detective and he was looking up the cases and he said, well, this victim, there's a lot of notes. Looks like she had 4 interviews. And then he wrote uncooperative victim. And I thought, so if she went in for 4 interviews, what happened that made that term uncooperative victim? But we see that a lot and we need more research and more discussions on what that means.
No, thank you for clarifying that. I also didn't know that it was simply the way it was written by law enforcement. So, all right. Another question reads, what is the exceptionally cleared on the reasons given for the law enforcement chart?
And that is similar to the earlier answer. It was primarily just a couple law enforcement agencies, but they wrote exceptionally cleared quite a bit on cases without other information. So I love all these questions because it means that all of you are thinking about this and hopefully thinking about, in my jurisdiction, in the law enforcement agencies I work with, the prosecutor's office I work with, ask them these questions. How do you define exceptionally cleared? What do you consider as unfounded cases? What do you consider as an uncooperative victim? So this is meant to stimulate discussions within your jurisdiction.
All right, thank you. All right. Another question asks, can you say more about the 3% false claims, the 9% in state, and then 3% as the national stat?
Yeah. So the 3% for false claims was one county. So one county law enforcement said that they felt that there were false reports in 3%. And then another county said 9%. There has been research. David Lezak has done quite a bit of this research earlier, but others as well, on what is the false reporting in rape cases. And when we look at the research, it's generally between 2 to 8%, mainly more around that 3 to 5%, down in that lower end. And I think probably many of you listening know that that is probably the #1 false rape myth. There's this belief that there's a lot of false reporting in rape, and that's incredibly damaging because then we see that people are less likely to report. So it's been found to be between 2 and 8%, which is the same as other crimes. There's false reporting in other crimes as well. So we need to all work together to dispel that myth.
No, I love how you pointed that out earlier in your presentation as well. Right, the next couple questions refer to kind of that sleeping victim, but doesn't a sleep victim include a victim who is unconscious following intoxication or trauma?
Yeah, so the asleep victim, we looked at the correlation between if a victim was asleep and if they had been highly intoxicated. And there was some correlation, but it wasn't significant. So yes, that does include that. But it also can just be someone who's just fell asleep. I know there was also another question about sleeping victims. Was that associated with domestic violence? Do you see more sleeping victims in DV cases? That also, we looked at that correlation, and that was not statistically significant as well.
Okay, thank you. Also, did you look at any factors as to why or why not there was a finding of guilt by a jury?
I would love to dive in a bit more on these cases that were a trial with acquittal, but we did not look at the jury case and deliberation and findings.
Okay. Another question asks, were you able to see a difference between having a female versus a male detective?
Great question. I actually get asked this quite a bit. We did not have that information. In talking with survivors, I have found that it's more the person. Survivors can tell and pick up on when someone is really there to do a full investigation and is really caring about them and has that trauma-informed approach, whether it be male or female, but that is not a variable that we measured.
Okay, thank you. All right. One more question reads, do you have data on successful prosecution rates for other crimes to compare?
We did not compare data on prosecution rates of other crimes. When we look at national numbers, we know that other crimes, we can have low prosecution, but nationally, our findings align with, I think, everywhere. We know that sexual violence is very poorly prosecuted. And if we are working in this field, we know that the impact of sexual violence on the individual, on our communities, on our society, and if we want to make healthier and safer communities, we need to look at all of these questions that you all asked and others and really work together in our communities to improve our prosecution, which means also working together to improve our support for survivors.
Absolutely. All right. So we're almost at the top of the hour, but if you want to share any final thoughts, Dr. Valentine, or just any recommendations or steps in implementing that NIJ toolkit in communities.
Yes, if anyone would like to, you can email me, Julie-_Valentine@byu.edu. I am not the keeper of the toolkit, but I can help to link you to that. You do not need to be a researcher. I recommend that all communities do this. We do so much good work. And sometimes we don't always measure our outcomes. And I think this toolkit allows us to measure just one outcome, but an important outcome. And there are other outcomes that we can look at, but looking at what actually is happening in these cases in the prosecution, I think is critically important for our communities. I hope that this has you thinking about all kinds of questions you want to work together as your community interdisciplinary partners as you address sexual violence, and that you openly have these discussions and really ask what's happening in these cases. So thank you for listening.
Yeah. All right. Thank you everyone for attending the final webinar in this series. As Dr. Valentine said, feel free to reach out to her for any questions, comments, anything on your mind. Thank you everyone. Bye.
Before you leave today's webinar, I'd like to draw your attention to our feedback form. It takes less than 5 minutes to complete and can be accessed via the checkbox icon directly above the chat. Your honest feedback is invaluable as we continually search for ways to improve and provide the best experience possible. Lastly, across the top of the live stream window are links to our social media profiles, including Twitter, LinkedIn, and Facebook. There is also a link to the FTCOE website, the Just Science podcast, and the FTCOE newsletter registration. Like, follow, or subscribe to stay up to date with everything the FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day.